Now, I hope you're ready for the next session this afternoon. I will be taking care for the rest of the day. A little introduction. My name is Ariane Alcorta. I am an international journalist and event moderator based here in Switzerland. And it will be my pleasure to guide you until this evening. So, before we start our panel, I want to spice things up by asking you a question. And we will be having it on screen. You can access it by scanning the QR code with your smartphones. And the question is, which type of activities are essential for the long-term risk reduction in healthcare systems facing climate change? I'll give you a few moments to answer this question. And once you answer it, you'll have to hang in there until the rest of the panel to be able to compare your answers. So as the question hinted, we are about to understand how some healthcare systems are negatively impacting our environment, especially in countries with limited resources. Depending on the country, healthcare systems contribute between 3 to 10% of national carbon emissions. Europe and the US have studied this and are already working on solutions. But in resource-limited countries, the conversation is just starting. These countries face unique challenges like waste management, energy efficiency, and supply chain optimization. The goal here is to identify the obstacles and opportunities for making healthcare more sustainable. The moderator leading this session is someone with nearly 2 decades of experience in African public health. He served the Kenyan government in various capacities, including as a public health officer. His expertise includes climate change, disease control, and innovating in public health financing. He is currently the Director for Population Health and Environment at Amref Health Africa, one of the continent's leading research organizations in health development. Please welcome Dr. Martin Muchangi on stage.
Colleagues, ladies and gentlemen, good afternoon. Once again, my name is Dr. Martin Moshangi, and I work for an organization called Amref Health Africa. We are based in Africa, and our goal is creating lasting health change in Africa. We were founded by doctors, and the aim of those doctors was to reach everyone in the remote areas of Africa. But today, and everywhere across this world, we are faced with a major challenge. And the challenge is climate change. Climate change is a resource taker. Everyone is feeling it, whether in the health sector, whether in the transport sector, the agriculture sector. But at the end of the day, it begs the question, what is it that we should be able to do to create a resilient health system? And that's why we are here today. We are going to discuss the nexus and the mix between climate change, the environment, and the healthcare system. And for us to do that, I have a panel of 4. I'm going to call them on stage, introducing each and every one of them. Just to really say, we would want this to be a very interactive session. We want to tell you what we know. we also want you to ask questions so that at the end of the day, we'll have very key takeaways that are going to influence the way we do our research, the way we influence our policies, and the way we push our practice forward. So allow me to begin by calling to stage the first panelist. My first panelist is going to be Sonia. Sonia is, please give her a round of applause.
Thank you. It's good to be here.
Good. So Sonia is the director, the executive director of Geneva Sustainability Center. She's been working in this federation for the last 30 years, and she has so much experience in terms of, the connection between the social aspects of the healthcare. And the other piece is around the climate policy, and the other piece is around sustainability. Allow me to also invite the next speaker, who is Habib. Habib, come to the stage. A round of applause. Yeah, Habib has over 20 years of experience in international health logistics. Habib has been working in the areas of clinical trials. He understands the depths of biomedical studies, pharmaceutical distributions, and he will be speaking more specifically about management of healthcare waste.
Good afternoon.
Good. And then allow me to invite to stage Dr. Kiran. Dr. Kiran works for Action, he leads the Climate Action Accelerator program. He's a medical doctor who is specializing in family health practice. It's very nice to have you here, Dr. Kiran, because one of the key struggles is that we have been having is having medical doctors to appreciate and understand the connection between climate change and health, and how it's actually affecting family health and the patient care system. Then lastly, I'm going to have Dr. Iris Brom. A round of applause. Dr. Iris is working for the London School of Tropical Medicine and Hygiene. She's also a researcher. And more specifically, she is so much involved with issues to do with UNFCCC. And for the purpose of just expounding, UNFCCC is the UN body that helps in developing the climate change policies. She is so proud within the processes of WHO, and she is leading the processes around research on climate change and health. So you are welcome. Now, for the purpose of just really making sure that you are comfortable, I'll pose questions. The moment you answer, we have like 1.5 hours within this session. Should you feel uncomfortable, you can take a seat, okay? Yeah, but I encourage you to be here with us, yeah? It's also some part of exercises. So, good, I'll begin with you. Sonia. And I would want to request you to speak a little bit about, first of all, how climate change has affected the healthcare system. And then number two, you can dive a little bit deeper around the actions which are already happening to address those challenges. You can take the context of the low middle income countries, or even where you are working and where you are living. Over to you, Sonia.
Thank you so much. So, I work for the Geneva Sustainability Center, and that's part of the International Hospital Federation. So I'm very much going to be coming from the perspective of how does this impact people's individual health, but also the healthcare systems that support them. And I guess from my perspective, I would always say that the climate crisis is a health crisis. And that's my starting point. I'm a health professional, and I'm really doing this because I believe in doing something right for our people and our planet. But if we think about it, this climate crisis is affecting people's health all around the world. I don't think there's anybody that's untouched by it. We're seeing in Canada currently the bushfires starting again. We know there's been flooding in your home country and in Kenya recently. We've had a rotten May in Geneva, actually. Not that it will have impacted people's health other than we're looking forward to summer. But, it has an impact on everybody's individual health. And then we've also got, the pandemics that we've been through, which have also been created by our loss of control of our environment, the fact that we're not actually looking after our planet in the right way. It also impacts on how healthcare responds to these things. So be we responding to pandemics, be we responding to floods, fires, heat waves, changes in disease patterns, this is really a serious thing for the health sector to consider. I also think that if we don't do this right, it's going to exacerbate inequalities amongst our people and our societies. And so there's special attention that needs to be taken about to look at this. But at the same time, I'd like to suggest that our health services around the world are also in crisis, and probably more so in some of our more vulnerable contexts. And that's because we've got financing issues that are a problem, actually, probably in most parts of the world. The rising costs of healthcare, the rising demands of healthcare, the rising expectations. There's something we're going to have to do about it because it's not sustainable. On another level, we've got a human resources issue. So, we need to have the right kind of people in the right kind of places at the right kind of time. And a lot of that's going to mean that we might have to consider looking at the models of care, the very mechanism of delivery of healthcare, in a completely different way. And I think this is where I would really hope that some of what we do to respond to climate change is going to help us leverage more innovative ways of looking at healthcare that actually deliver better population health, but also help with the planet. So I'm looking to some of these vulnerable contexts to help us find some of the solutions, not just in these contexts, but also in our very over-resourced world where, frankly, we need to decarbonize very rapidly. That's the beginning of an answer for you.
Thank you. Thank you so much, Sonia. Yeah, and just to advance that conversation, I would like to pick your thoughts, Habib, around, first of all, the work which you are doing around preparatory work, the logistic pieces, the waste which is generated in hospitals, the treatment technologies that are there in, and at the end of the day, what you see in terms of the greenhouse gases that are produced out of that, knowing very well that out of all that actions, all those actions I mean, at the end of the day, there is direct impact to climate change. So could you please tell us exactly, in your practice, what you have been doing, how you have managed to deal with healthcare waste, and how you are connecting that to the entire subject of climate change? Over to you, Habib.
Thank you very much. So I will try to be as clear as possible. English is not my first language, but you will pardon me if I'm not that clear, but I will have probably to switch in French at some point.
Okay.
Anyway, so thanks for inviting me. Actually, I'm really happy to be here and share with you the sport experience that we have in Senegal. So my background is in logistics. I have supported clinical trials at the global level for years. And I went back to my country in 2019 and found out that there was a situation which was absolutely concerning regarding the medical waste. To be, in short, we have medical waste that we were finding on the beach, polluting the coast, and medical waste also that were found within the neighborhood where people are living. So it was quite concerning. So what happened is that we look at the situation with one of my friends. We start discussing with some of our relatives working in the medical environment, and we found out that it was really a problem. And that problem was not only for Senegal, but in general West Africa and even Central Africa. And this is where we start from. And to tell you how it is a problem, even when the medical waste are stocked or stored in the healthcare environment, they participate to up to 10% of the nosocomial infection. And this is a number which is given by WHO. So this is not me inventing the number, just to tell you how actually it can be impacting the patient, impacting patient family which are coming to visit them in the hospital, even the health workers. So for Senegal, we estimate at 21,000 tons per year the amount of medical waste produced for a country of 18 million people. The solution that we put in place is a solution that is addressing only 3% of the problem. We have a capacity to treat up to 600 tons of waste per year. And the idea when we started is to show that there was a model that could be created which actually can solve the problem by structuring, let's say, an industry around the waste treatment, the medical waste treatment. So the idea was to allow the government to identify the different actors, make sure that the three regulation around the medical waste in Senegal can be actually applied or enforced, and then be able also to agree with the authorities that the solution is to outsource the medical waste with people who know what is it about. So after 5 years, we have first put together a fleet of vehicles which were allowing the medical waste producer not to use anymore their own means of transportation. What I'm trying to say is that a doctor, for instance, before we put the solution in place, was forced to use his own vehicle to take those medical waste to the nearest hospital, because the public health sector was the only solution for the private sector to destroy the waste. So that was the first step. And then we have struggled to find a financing, but at the end, I will have to say that it is because of the COVID that finally people have took the problem seriously. And then we have a bank who agreed actually to loan us 420,000 euro, I think, to buy the equipment that we're using to treat the waste. And I'm giving you that number because that number already show or actually explain the reason why it is difficult to solve that problem. Because the equipment by itself already is very expensive. And that equipment is an equipment which is, actually the technology is a sort of a microwave that is used to decontaminate the waste. And we chose that one because the idea was that after decontaminating the waste, that we can recycle the waste. So we come to that point now, after 5 years, but we cannot recycle all the waste, but a part of it. But at the same time, looking at the cost of the solution, that also explains why actually there is not so much candidate or private candidate to go into that solution. So I will stop here and let you ask questions. I have plenty to say about it, but that was just my introduction.
Thank you. Thank you. Yeah, you want to clap? Please do it. Yeah. Good. Thank you so much, Apip. And I know I'll be coming back to you, and especially to just get your thoughts about infection prevention per se. And once again, let me redound that I'm so happy to see nurses, medical doctors, paramedics on the stage, because one of the greatest struggles that we ever faced when we were trying to introduce the subject of climate change and health was that doctors were like, no, that is something to do with the environmental issues. Doesn't have to do anything to do with us. It has nothing to do with the healthcare. But right now, I can see I have Dr. Kiran. And Dr. Kiran, I know you are not an environmentalist. You are actually a medical doctor. But I want to ask you to speak what you have known about the issues around mitigation and adaptation. What is that? And then number two, why is it important to balance the actions around mitigation and adaptation with regard to climate change? Over to you, Doc.
So thank you very much, and thank you for the invitation to join you for this session. Yeah, I hope I'm becoming more and more of an environmentalist every day, actually, but it's true that I started out very much with, I suppose, one of those doctors' perspectives of, everything is about increasing coverage, increasing quality. That needs to be our priority, especially in lower resource settings. So it's a bit early to talk about mitigation in these settings. This is what I suppose at the beginning, this is what I was thinking. I thought, well, yes, emission reduction activities, that's fine, but that must be absolutely integrated with resilience building activities. Because health facilities, particularly if we take the example of Sahel, where we've been working as the Climate Action Accelerator with partners in the Sahel, facilities are faced with the challenges of meeting already very overwhelming needs relating to malnutrition and seasonal malaria peaks. And this is changing and evolving and becoming more and more intense, and at the same time there's the country commitment to universal health coverage. So all of these pressures mean you need to deliver more care, not less. So how can we be thinking about emission reduction in these settings that are contributing very little emissions in the first place? But I guess gradually what we've seen is that there are many ways that you can do adaptation activities. We could follow a high energy, high carbon trajectory like many Western countries have chosen. We can try and find trajectories that are more climate smart, that make best use of local resources and expertise. We can try and find different ways different trajectories to move on as we're extending coverage and working on quality of care. So I think I would say firstly it is both, I think it's ethically and strategically important to put resilience at the center, but actually we cannot separate that from mitigation. I think this example you just gave, Habib, is perfect because that is, you may start by saying that's a mitigation activity, but it's absolutely an adaptation activity. You're reducing the nosocomial infections in your facility, that they themselves are a distant consequence of the climate crisis. So I want to give another example a bit on those lines, where we've been working with the international NGO Alima and the Chadian NGO Alert Santé and the Ministry of Health in Chad to support the Nguri Hospital to transition to a climate-resilient, environmentally sustainable hospital. Now, as we went through this process, we developed, together with the hospital leadership, a mixed methods participatory climate vulnerability and capacity assessment. So I think many people will be familiar with climate vulnerability capacity assessments, but we developed a participatory method, particularly to make sure that community voices, health workers, all participated in the development of the adaptation plan that came out of this. And I came at this, as I said at the beginning, more from a disaster risk reduction mindset. I was thinking we're going to prioritize mostly resilience activities to make sure that the facility can manage ongoing and future climate crises, climate shocks. But interestingly for me in the process, the actual range of activities that were prioritized by the staff and the community were activities that I hadn't thought of as immediately resilience building activities. They were focused, there was a lot of focus on waste reduction. There was a lot of focus on dealing with the mountain of plumpy nut sachets. Plumpy nut, the treatment for malnutrition, which comes in a sachet that you can't burn in a conventional incinerator. So this was taking up masses of space in the hospital. And from the perspective of the staff, these were absolutely issues about resilience, because when you've got a messy, chaotic area in the hospital, that doesn't give the staff confidence, that doesn't give the patients confidence. Aside from the risk of nosocomial infection, which no one had been able to quantify there, just the very perception that creates of a build-up of waste in the hospital. That was a key preoccupation for staff. So in the end, this adaptation plan for the hospital, it comprised activities that were much more conventionally thought of as resilience-building activities, but actually activities around waste reduction were very, very central in the plan. So I think I'll stop there. I just wanted to highlight that it wasn't, this was very much grounded in the priorities of hospital workers.
You can give him a clap, yeah? Yeah. Thank you so much, Kiran, for giving us those highlights transacting between the challenge and the actions which are happening practically to minimize waste and to ensure that, we are not becoming the net contributors to the greenhouse gases emissions that we are all trying to control. Now, once again, let me repeat and say that we are lucky, because once you have the youthful voice on the table, that's point number one. And then point number two, when you have doctors, again, speaking about these issues, we have an advantage, because when it comes to decision-making, pushing policies across the health sector, then we will be better placed. It will not be a push kind of an action, because the health sector itself will be like already thinking of the things that they can do to work around climate change and health issues. And so for that case, Dr. Iris, I know in a big way you decided to leave the clinics and get engaged in policy influence on climate change. I know you attended COP 25, 26, and 27. Your voice has been very strong. So could you please tell us about, first of all, your experience in engaging the climate sector, the UNFCCC processes, and what is it that has come out of those engagements so far? What should this group know about how far we are at this point? Over to you.
Definitely. Thank you so much, Dr. Martin, and thank you to the organizers for the invite to be here with these amazing co-panelists. I'm very, very happy to be here talking about what I find to be a very, very important topic. So I'll start by saying that I very much recognize what my co-panelist Habib said about the COVID-19 pandemic. My first COP that I attended was pre-pandemic, 2019, where it was incredibly difficult to talk with stakeholders in that climate space about the importance of health, which was the reason that I was there. I saw that change very drastically after the pandemic, and we do see a big increase in momentum around climate change and health in the climate space as well. So I want to highlight that, and I'll talk a bit about what it is that we then see right now. So starting out with COP26 in 2021, we see this growing recognition of the intersection between climate change and health through the health program that was launched at COP26. We now have 82 countries that have signed on to the COP26 health program, and a majority of those are low and middle income countries, and they have committed to developing climate resilient and low carbon health systems. Recent COP28, where I had the privilege to be present as well, saw its first health day, so a thematic day around health within the space, and specifically also the COP28 Climate and Health Declaration, which emphasized the urgent need for integrating health considerations in climate policies, where more than 140 countries have recognized also specifically that the health system can play a pivotal role in driving sustainable practices. All of this is further underlined in the draft WHA World Health Assembly resolution that's actually currently on the table in the WHA space. So that reflects a lot of that, how it's coming back in policy in different spaces at the moment, and definitely also a high momentum around this area of work. I do want to mention, and the topic of equity when we're talking about this, because I just quickly mentioned the COP26 commitment. Majority of commitments are coming from low and middle income countries. We know that low and middle income countries are facing the worst impacts of climate change. We also know that historically high income countries have been the highest contributors to climate change. From the COP26 commitments to sustainable healthcare systems, we see that a lot of high emitters are missing from those commitments. So that is a first gap that I identify in an area in which we need a lot of improvement. I also very much appreciated what Karen shared with us just now around sort of breaking the silos between adaptation and mitigation. This is something that I also try to do in my work, and recognizing where there is opportunity to improve both. And I think it's too easy to say in low and middle income countries there's no attention to mitigation, all attention should go to adaptation. I think there are a lot of, especially middle income countries, that have rapidly developing healthcare systems where sustainability is a major priority for the people there. So I think that is very interesting and an area that should be highlighted further. There's a lot that can be learned from the incredible efforts that are happening. Talking about those commitments that have taken place, in addition to filling the gaps with the high emitters joining those commitments, I would also say that it is crucial to establish robust mechanisms for evidence creation to guide countries and health systems, and also sharing around that, and accountability. So this involves, one, transparent reporting. So governments and stakeholders must regularly report on their progress in meeting these different targets that have been committed to. So the WHO's Health and Climate Change Global Survey could serve as a model for this, providing a comprehensive framework for taking and reporting progress on health-related climate action. Second, stakeholder engagement involving local communities, healthcare professionals surely as well, youth I would specifically mention here, civil society in the decision-making process to ensure that the implemented policies are not only effective but also culturally appropriate. Engaging a broad range of stakeholders can help tailor solutions to specific regional needs, foster community ownership in these climate and health initiatives. And third, what I would mention as the end of my intervention right now is monitoring and evaluation. So implementing independent systems that can monitor and evaluate the impact of different policies that are being implemented, and also help identify areas of improvement, where can we do better, ensuring that adaptation and mitigation strategies are indeed effective. So this can include developing indicators for measuring the effectiveness of interventions and conducting regular assessments as well. So I will stop there for now. This would be my first response. Thank you.
Thank you. Thank you, Akra. Very well said. Now, for the purpose of what all the panelists spoke, there are some key ones which emerged, and I'll just pick them out. So the first one which came out strongly is that we are in a crisis. There's no question about that. It's a crisis that we are dealing with, and it's about climate change and its impacts on health. We got very clear statistics. The second key one which came is the issues to do with the diseases, the pandemics, right? That came out very clearly. And if I am very clear, Sonia saying that we actually expect that this is going to become worse. The third thing which I heard clearly is that the next challenge will be the human resources for health. And that's the reason why we need to keep on pushing this topic of climate change in the health sector, so that nurses, doctors, other paramedics actually understand the impacts of climate on health, and to start getting engaged all the way from the community level, the family health kind of care. Then I heard very clearly Habib saying that technology transfer is the other thing that we need to start thinking about. And so for us to deepen this topic, I'll come back to you, Habib. Habib, you spoke about infection prevention and control. And when you were speaking, something came into my mind, first of all, to ask, Do we have policies? Do we have policies that are available, and especially from the low middle income countries, to support appropriate infection prevention and control? So that's point number one. And then number two, within the big mix of climate change and health, have those policies been integrated within the bigger framework of national adaptation plans and the climate plans in those countries? So that, yeah, we need to start questioning ourselves how well we are now starting to bring all this together within the framework of a common church. Over to you, Habib.
All right, thank you very much. So for the first question, I think that the problem is that there are rules, there are regulations existing. The only thing is that it is difficult to apply them. For one reason is that what I was saying about the public sector being the solution to treat the medical waste, meaning that the private healthcare system is completely dependent of the public sector, which means that when you have an equipment in one of the public hospitals which is default and not working, that means that all the system around is not working. That means that the waste cannot be treated anymore, which means that after a few weeks, those wastes will go into the household waste and then create the problem that I have described earlier. So even if the regulation is there, and even though the officers in charge of, I don't know how to translate that exactly into English, but in charge of the hygiene and security, hygiene and safety are doing their work. And he found out that there is a problem with his healthcare organization not treating their waste well. There is a sort of tolerance because it will be difficult for them to give a fine to someone who is proving them that he went to 3 or even 5 hospitals around him and no one could take his waste. Why? Because sometimes it's not that the equipment is not available, it's that the equipment is not even able to dispose of their own organization waste, which means that a public hospital produces more or less 300 kg of waste per day. So if they're not able to absorb this quantity, they cannot take any more for anyone else. So that's one of the reasons why the regulation in general is not able to be applicable. And once we say that, the situation that I just described are mainly in the capital city. So when you start going further into the country, it is even worse. So that's the reason why every time that we have the opportunity to talk to one of our authorities, the model that we're bringing are the models, at least in West Africa, the ones which are the closer to us, the Tunisian and the Moroccan cases or examples. For instance, what Tunisia did is that they had 33 public hospitals. They took 3 private companies specialized in medical waste. They give each of them 11 hospitals to take care of. And then they say for the private healthcare system, and then it's for you to compete. And this is how they solve the problem. After 5 years, everybody had a solution to treat the waste. There is no more excuse to say that I don't have the solution. It's just a matter to respect the rules. If you don't respect, you get a fine, or actually you can even get your institution closed. In Morocco, they did the same. Today in Morocco, there is even up to 6 or 7 companies which are only specialized in medical waste. Just to tell you that there is a solution, there are ways to go, and sometimes it is just a matter of the authorities to decide the approach that they want to take. So I hope that I've addressed your question.
Yeah, thank you. Thank you, Habib. Yeah, very nice. Please feel free to clap. Yeah. And what is coming out very clearly is that we have a gap between the policy-practice mix. And therefore the question is, how best can we pick the best practices, like what you spoke about, where things are happening well, and transfer that to other countries, right? Yeah, so that's something we need to think about, like how practical we should be in terms of systems, in terms of connections, in terms of forums, etc. So now, Sonia, you see, what came out very clear is that we are dealing with a crisis. And somebody said, never waste a crisis, right? Yeah. So now my question to you is, how can we use the climate crisis to transform the healthcare system to become a more resilient system? Sonia.
Thank you. So yeah, of course, we must not waste a crisis. I actually think that this is the crisis to help us transform everything in the health sector. Maybe a bit optimistic, but actually we've only got one, it's urgent, and we've only got one shot at it if we really want to do it well. If we want to address the issues of waste, of resilience, of how we decarbonize, how we actually support the financing, how we get what I call green UHC. You know, we need to enable countries to be able to develop access to universal healthcare in a green, equitable, safe, well-financed manner. And actually, we're only going to get one shot at it. And I really do believe deep in my heart that in vulnerable countries, we've got a better shot at doing it right because it's so needed. You know, your example is fantastic in terms of you had to just get on and find a solution. During the pandemic, there's hospitals that were left without any supplies of single-use items. They found ways of reusing items, doing something that would be different, and actually they've ended up being more resilient as a result of that. I've also heard of hospitals that have used drones to deliver medicines instead of trying to drive them with trucks and all sorts of other things. So there are solutions that are going to be out there. I'm rooted in practice. I really do believe that actually it's if we can have these examples that we'll be able to change policies and get the world to see that it's actually not all that complicated. There are solutions. So I think we should use this crisis wisely and start transforming the healthcare system. But it does mean going beyond even what we're talking about here, about how do we ensure low carbon care pathways, how do we build resilient systems. It does mean addressing some of the other fundamentals as well around financing, human resources, and maybe being less building dependent. My dream, they never waste a dream either. If you want, you know, my dream would be that actually in vulnerable contexts, you could start developing solutions that might be more fit for purpose for some of our highly resourced countries that have got the model of care wrong, frankly, that is overly resourced, overly intensive, does not necessarily drive better quality care or better population health. And if I can just use one example, it's the carbon footprint that a professor in New York did on a cataract surgical pathway in India compared to the UK. It's 90% less carbon intensive because of the waste reduction, because they used reusable items by design for the same quality outcomes. So it can be done differently, it must be done differently. So I really hope that we can transfer that knowledge as quickly as possible. Thank you.
Thank you. A clap for Sonia. Yeah, and I like the way this conversation is building up. Because now the issue around financing is coming out. The question being, how do we do this? How do we implement actions without the money to take us forward? And so I want to come to you, Irish, and when I come to you, I want you to reflect. There's a lot of conversation now going on from the policy perspective. You mentioned the WHO resolution on climate change and health. You mentioned COP28 declaration on climate change and health. I know we are going to Azerbaijan for COP29. So the question is, how do we leverage on these conversations to ensure that money is flowing to the health sector to support addressing these aspirations, the dreams, the crisis, and all that? How do we ensure that we are connecting the dots between what we are speaking and how to move forward in terms of financing? Over to you.
Yeah, thanks so much. I'll start to respond to that question by highlighting sort of two gaps that I see in this space, and one area that gives me hope, and then I'll go on to some more of the solutions. But first of all, I really like this conversation because I very much see, as I just highlighted before as well, the need to break silos between adaptation and mitigation. Also the need to break silos between climate space, health space, which is luckily steps are happening towards that direction. For instance, energy efficient healthcare facilities not only reduce emissions, but can also enhance resilience. Dual approaches in such solutions as well are particularly beneficial as well in resource-constrained settings where resources must be optimized. Second, highlighting best practices. So I think it's been said by my colleagues before, there are many settings, including in low and middle income settings, where there's high quality, sustainable healthcare with limited resources. Innovative solutions, and these examples demonstrate that sustainable practices can be achieved with a fraction of the resources that are being used in high-income countries, specifically in healthcare. So that sets a powerful precedent as well. And finally, what gives me hope in these spaces is that there is a very strong community of practice. The climate and health community, including a lot of young healthcare professionals, healthcare profession students, and others, and more different experts that we also need from many different areas, are joining this community and actually have been very much vital within, for example, the UNFCCC space in ensuring that health considerations are included in climate policies. Just to give a very specific example, the first draft of the Paris Agreement did not even have the word health in it. During negotiations, the health community pushed very hard to make sure that the word is in there. Luckily it is now, but it wasn't in the first drafts. So that just goes to show of what an important role this community plays, and probably also many of you in the room. I'll go to a bit of insights and solutions. So my research involved, amongst other things, a systematic review of greenhouse gas mitigation interventions, specifically in healthcare systems in low and middle income countries. Key findings include 1, energy interventions, so full or hybrid renewable energy systems such as solar, photovoltaic combined with other sources can in specific cases significantly reduce emissions and ensure reliable electricity in rural health facilities. So these systems not only mitigate emissions but also improve health outcomes by providing uninterrupted power for critical medical equipment, for example. One example, a study in Nigeria found that a hybrid energy system for a rural healthcare facility could reduce emissions up to 83% compared to the previously used diesel generators while ensuring consistent energy supply. Second, waste management. Effective waste management practices such as segregation, recycling, and composting can also drastically reduce emissions from healthcare facilities. In a Pakistan facility, integrated waste management systems showed a 62% reduction in emissions compared to traditional methods. Proper waste management also reduces the risk of nosocomial infections, which was mentioned before. This also came out of the systematic review, which are linked to poor waste disposal practices. Third, you talked about finances, so economic viability of these types of solutions. What are we actually looking at financially? Initial costs of implementing some of these renewable energy solutions, also waste management systems, can be high, but the long-term benefits, including the cost savings and also the improved health outcomes, can outweigh these initial investments. That's what some of these case studies actually show us. So government funding, but also international climate financing in an equitable manner and fair manner, of course, are essential to support such initiatives, to set them up. Findings included cases in which the return on investment for solar energy systems in healthcare can be realized within 3 to 10 years, providing significant cost savings over time. So this is an attractive case, investment-wise, that we're putting in front of investors here. So in conclusion, what I'd say is the commitments made at COPs represent a significant step toward integrating health into the climate agenda. However, it is imperative to ensure accountability, leverage lessons from successful implementations, and by adopting sustainable practices, breaking down silos between adaptation and mitigation, we can create resilient low-carbon healthcare systems that not only protect the environment, but also very much improve health outcomes, including for vulnerable populations. Thank you.
Thank you. Thank you, Heidi Sakra. Yeah. Yeah, and just before I let you rest, what should we look out for COP29, the upcoming COP29?
Yeah, that's a great question. I think COP29 will hopefully see an increased and continued momentum around climate change and health. We saw that momentum very high at COP28 with the Health Day for the first time, with the declaration that built upon the 2 COPs before that. I hope to see that continued. So I hope to see something around a Health Day, high-level declarations. Also very much so from the health perspective, every reduction in emissions means a win for health. So that means that we must see a fossil fuel phase out in order to have healthy people. So that is what I see as where the health argument can hopefully contribute to stronger outcomes in COP28 as opposed to previous COPs.
Thank you, Iris. Very well. So, Dr. Kiran, when I was speaking the earlier conversations from our colleagues, something came out very strongly, that number one, we have guidance, and especially from WHO. And we also know that there is that group within the communities that we live with that are most affected, and that's women and children. So I wanted to pick your thoughts around what are the challenges that you have encountered in terms of implementing the WHO policies and guidelines that have already been constructed from your practice perspective. Over to you, Doc.
Yeah, thank you for the question. As I was listening to Iris, I was thinking, yes, it's great. There is more and more evidence on individual solutions for climate resilience, environmental sustainability. But I think there's still an implementation gap at the level of how to bring this all together at the level of facilities, primary care facilities, secondary care facilities. And we hear from WHO colleagues from the Attach Consortium that the lack of worked through models of implementation of the WHO guidance, that is a blockage. I think, as Habib said, it's important to have worked through examples from the context or from a similar context, because the collection of interventions required for a hospital in one context to be resilient, it may be completely different from another context. So that implementation gap, I think, is a big challenge, and it's important to have these models, the models whereby that WHO guidance is implemented or adapted to the setting, and they're costed, and there's an attempt to measure the impact on resilience and sustainability. I think that's the first challenge, and I suppose with CAA we've been trying to address that by working with health facilities on to transition in a holistic way to climate resilience, environmental sustainability. But through that process, we've observed other types of challenge, and I think those challenges will be different in every context. But just to give an example, I think I suppose the first point is, how do you do this in an all hazards way? That's a bit of a jargon expression, but from the perspective of the facility, they're not just concerned with the climate crisis. They have to, there may be all sorts of other crises in that setting, whether it's pandemic, it's conflict, and the fact is that the solutions to increase climate resilience will overlap and may be actually very similar to the solutions that are required for risks due to other hazards. But you need to think about this as a whole, because as I said, the climate is not the only crisis affecting these populations. To give one example of that, we've seen, I take the example again from Chad, reinforcing the blood bank, building a multifunctional structure that could be used for during the malaria peak for extra beds, but at other times can be used for sensitization of the community. These were the types of solutions that were being prioritized. Yes, there was a big emphasis on solar, on autonomous energy supply, certainly, but some of the solutions were very much not, let's say, climate solutions or solutions that we might imagine as being, obviously responding in a linear fashion to climate hazards. So I think it's very important to see the hospital as a whole and or the health structure as a whole needing to face the variety of hazards and therefore the variety of risks in that setting. And as I said, they're very integrated because the climate crisis actually is a risk multiplier for all these other hazards. So in fact, it's not actually such a separation to be thinking about them. It's not so complicated to put them together. I think the other thing I want to mention is about integration with systems level and community level resilience. So that the WHO guidance, there's one document for the health system, and there's one document for health facilities. Now that health facilities document assumes that those health systems issues are being taken care of, health programming, leadership and governance. But in many contexts that won't be the case. A facility in Chad, in a setting which is where the central health system is under-resourced, the facility cannot wait for national level contingency planning, EPREP, to be put in place. They're having to face these issues immediately. So what we've seen in many facilities, there's the need to integrate systems level thinking and community resilience thinking, because a hospital sits in a community, but it's also part of the health system. So at the level of that facility, the facility, yes, needs to think about infrastructure, about energy, about water, but needs to be thinking about EPREP. It needs to be thinking about seasonal risk calendars so that you can move your limited buffer stocks between facilities as required. It needs to be thinking about the community resilience, those structures that already exist in many contexts, disaster management committees, community committees that already exist. They need to be brought in, and they need to be brought into connection with the health facility so that the climate risks can become part of the work of those committees. So I think thinking about how a hospital is part of a system, both a community and a health system, that has been something that we've learnt through this work, and I think it's going to be both. You could argue it's a barrier, but I think it's not a barrier. It's also an opportunity to strengthen the resilience of health facilities going forward. Thank you.
Thank you. Very well said. Just give him a clap. Yeah. Very well said, because what I hear is that we need to now start breaking the silos, both in policies and practice. You cannot treat the community out there and then the health system here, and then you are saying that you have policies and you have, it makes a lot of challenges in terms of implementing all that. Now, I know we have spoken a lot from this side, and we want to listen to you. We want to take questions. We want to interact with you so that we hear whether you have additional thoughts and all that, yeah? So there is a roving mic, and I'll begin with this gentleman. His hand was up, and what we will do a mix of gentlemen and ladies speaking. So I'll do that mix, right? Okay, go on, please. You can introduce yourself, say your name, and then ask the question.
Yeah. I'm Dr. Francis Akambiemu, a consultant public health physician and chief executive officer of a subnational health organization. I listened to Habib on issue of waste contaminants, health waste contaminants, and that some of these waste are found on the river, on the shore, and also within the community. But you mentioned mainly nosocomial infection aspect of it. And my thinking is this: when you find waste in the shore, you find waste in the environment, the hazard, with this climatic change, there are a lot of erosions now, more rains. So the community aspect of this hazard is even higher than the few ones that you can track at the facility level. For example, some of our health centers will notice when we go for supervision that dogs, stray dogs picks placenta, picks body tissue, and they move to the houses of their owners. And sometimes around where they don't have good waste management, what rain falls, wash this into the stream where people go bath and take water. So the climatic change that have increased flooding, erosions, with this health care waste disaster is beyond just the nosocomial aspect of the problem. So now, when there are policy from national, I'm a policy maker, you make policy. Yes, you may be able to implement it at the level of the hospitals, but what about the primary healthcare centers that do not have a fence? They live within the community, and this waste spread from those their health centers to members of the community. It's a very big problem. I believe, just like one of the speakers said now, that you cannot...
Francis,
yeah. Okay, sorry.
just keep it very short.
Okay,
yeah?
so what we are
Ask
saying
your
is that
question, yeah.
let this discussion go beyond here, but to national government on how they will integrate policy with practice at the lower level of healthcare service delivery.
Thank you.
Thank you.
Thank you, thank you. Okay, there is a Arinde over there, just behind you. Yes, he was actually second. Go on. I'll pick just 4 questions and then we'll take them, yeah? Okay, good. Over to you.
Hi, my name is Polina. I'm a physio and I also perform some environmental footprinting of clinical practices. My question is also is about medical waste. From my research and research that I see from colleagues, I often see that the amount of medical waste is very often due to the fact that we use a lot of devices that are only single-use devices. So I was just wondering what were your thoughts about investing not so much in infrastructure that is dealing with waste management, because that's the end of life of all of those devices, but actually investing also in infrastructure that can decontaminate, sterilize devices that can be reused.
Thank you, Rina. Okay, so then I'll just move that way for the, just to become, logistics efficient. Yeah, over to you, over there, and then this Arinde over there. So go on. And
Thank you. I am Francesca Edet. I represent my religious congregation at the United Nations. I belong to an international religious order, so I'm a Catholic sister. I have had some good conversations since morning. This afternoon, I have listened with keen interest on what our 4 panelists have had to share, and I'm picking up from what Habib has actually said to us about best practice, bringing best practice from Morocco and Tunisia to some other parts of Africa about waste management. We have talked about policy. We have talked about reporting. Here, we have talked about breaking silence. I would like to emphasize on unblocking the ears of duty bearers. Because sometimes we break so much silence, but the duty bearers pretend they don't want to hear us. Policies and reports that are brought to this global conversation, how do we ascertain that what is written on paper is actually the practical issue that has happened at the grassroots? Yeah. That's my question. Thank you very much.
Thank you, Francesca. And Rastri?
Yes. Hello? Oh, much better, yes. I'm Agnes Mahot. I come from the Institute of Global Health at UCL. Thank you to all four panelists for sharing their great thoughts. There has been a lot of discussions around breaking silos and systems thinking, which has brought me to think about One Health. So my question will be quite general to all four of you. How has sort of this development of a One Health approach affected practically how you think about and come up with solutions in terms of adaptation and mitigation to climate change? Yeah.
Thank you. So allow me to turn to my panelists again, and I'll begin with Habib. Habib, you can take the question around how do we extend the thinking around infection prevention beyond hospitals, because that's the question which Francis was asking, and saying that we need to think about primary healthcare levels and connecting the dots between what is happening in hospitals and you know, the households, right? Yeah, so you speak to that. And then the second question was around the medical waste that is generated as a result of being excessive in terms of the single-use devices and how best we can become efficient in terms of manufacturing, utilization, and minimization of waste, yeah? So you can take that one, Sonia. And then Francesca spoke about best practices. And I remember, Kiran, you spoke very well about, you know, the use of the ready-to-use nutritional supplements and the work which you are doing around minimization of waste, yeah, around that. Yeah, so it would be nice to just pick your perspective around how to make sure that those best practices extend beyond your organization, extend beyond communities of practice, and they actually produce to the entire group. And lastly, the issue around One Health approach, human, environment, and animals, addressing that all together. Will you be happy to pick that one, Iris? Okay, we are ready to go. I'll start with you, Habib.
All right, thank you very much. So, Francis, thank you. Dr. Francis, thank you for the question. And you're absolutely right. If you remember, I was saying that once you start going beyond the capital cities, the problem is even worse. And I was referring partly to what you have said. And the problem is that, in general, people do not even know, or how can I say that, or mitigate the risk which is coming with the waste being around, which means that they will not make the link directly between the kids or themselves being affected by a disease with the presence of the waste. So that's the first thing. So the other thing is that when we're talking about authorities, we're putting in one word a lot of, let's say, different departments. But the authorities will react differently depending on how close they are to the problem. So if you take the hygiene and safety, right, department, they are the one on the ground dealing with the waste, dealing with the infection, with the disease. So those people, I will have to say that those are my closer collaborators today because they have to solve practical problems. And they will be the one sitting with me 4 hours thinking about the plan. So we come to a point where the plan is first to sensibilize people, to educate them on the risk associated with the waste. Once we do that, we train the health workers on segregating the waste, even in the small organization at the lower level of the healthcare system. Once everybody is aware about the issue, then you can start controlling. And when you control and you see that people are not doing what they have to do, starting from segregating the waste in their organization, then you can start putting some sanctions. And that's the way that you will see, step by step, people improving. And then you will even have reaction from the community, which will not allow anymore to have some waste around them. So we see that happen, and I'm saying the communities, for instance, in Senegal, I'm not talking about even areas which are very remote. Even if you drive like an hour away from Dakar, it is even enough to find this kind of solutions, or situations, sorry. So that's to address your question, and this is something that we're seeing like every day. So, and I will give an example on how actually this is improving. I have also remarked that there is mayors today who are even not allowing some structure to burn waste like outside. And this was a situation which were not happening before. People will be burning waste like this, and no one will react. It will be normal. but now seems like there are some reaction which are going against that, and it is good that it is coming from the authorities. So I would probably take a few minutes more just to address the question of Madame Francesca, excuse me.
No, it will be taken.
Sorry.
It will be taken by.
Okay, sorry.
Yeah.
That's fine. So probably just to finish, I will have to say that we also, addressing the problem sometimes became more complicated because the environment, or let's say the question related to waste, is not the responsibility of only one ministry. So medical waste will be, in my country, let's say 40% will be under the control of the Ministry of Health. Another 60% will be in the hand of the Ministry of Environment. And then you will see that on the ground, you have the household waste management, which is taken care by an agency which is controlled by the Ministry of the Territory Building. So at the end, you have three ministries which are actually concerned by the problem, because the household waste management, whenever they go to a healthcare organization, what they're finding is that the medical waste is not segregated from the household waste. But the workers are not trained to take care of these dangerous goods, but they are the ones which are affected. So then you have to go back to the ministry, and then each of them want to take the role very seriously, and then the more you have people around the table, the less you're able to find a solution.
Very nice. Thank you. Very well said. And actually, I can see where you are driving us to. At the end of the day, we need to ensure that everyone comes to the table, multi-sectoral collaboration, and we ensure that we are putting people at the center, because the action has to happen with the people. Good. So I'll go to the next question, which was around the issues around minimization of waste, single-use equipment and devices. What would you want to say about that, Sonia?
Well, so absolutely, it's a community issue to deal with waste management. But actually, if you think that some countries generate up to 10 kilos of waste per day per patient, you know that we should really also put lots of efforts into reducing that amount in the first place. And I think there is something about adding to the people that are around this table, but, you know, with the private sector, with industry who are producing some of the equipment we use, we need to find ways of designing items that are reusable and that can be maybe autoclaved on the desk of a community worker or in a hospital, because otherwise we'll never get there. With the growing trends in healthcare, we're going to be using more and more. And it is sometimes in the interests of some of those organizations or companies to keep proliferating the single-use item when actually there are ways around it. And that's what I was referring to earlier, that during the pandemic, some countries, some hospitals, some clinics had to find solutions because there was no other choice. And we would do well, I agree with you, there's something about going upstream in the pathway and trying to find ways of making sure it doesn't end up there in the first place. And then there's another whole thing around segregation and how you actually do that properly, because there's a lot of differentiation there, and the treatment options could be that they could be microwaved and therefore treated in a different way thereafter. So there's a lot on this reduce your waste in the first place issue, then treat it well. I just think it's a very important point to mention. So thank you for the question.
Thank you. Thank you so much, Sonia. Now, I'll turn to you, Kiran, and please reflect a little bit about the best practices issues that Francesca was asking about. And she was so keen to understand about waste minimization. So how do we, scale up that best practice? How do we ensure that best practices are actually producing and are going far and wide? Over to you.
So thank you. I think I can answer part of the question about mainstreaming best practice, but the part about holding decision makers to account, that might be my colleague, Habib, maybe might want to add something to that, so I'll leave that to the chair to decide. But I would say that, firstly, I think so mainstreaming these practices, firstly, I think it's important from the beginning to be working both vertically and horizontally. And what I mean by that is I talked about integration of different solutions at the level of a facility, looking at a facility as a whole. I think it's very important to be working at that level, showing how to make that happen all together. But equally on specific, when I say vertically, I mean the specific interventions, such as how to deal with huge amounts of plastic waste in hospital, specific interventions such as I think we were talking about this earlier, about converting these plastic sachets into bricks, for example. I think there are many different approaches, but those need to be, those models need to be developed in depth for specific solutions. So we both need to look at the facility as a whole, and then we need to look at individual solutions. And then in terms of mainstreaming this, I think just from our experience, so the first thing I would highlight is that the health workforce were absolutely critical in I guess themselves disseminating and making these solutions catch on. I think that I'm going to go back to that same example of Ngori and Chad. It was the health workers taking sort of control and leadership of this process, and actually directing the process and advising actually which other groups should be consulted with, developing that plan together, that actually developed such a momentum for change and such a sort of a sense of ownership of this adaptation plan. So I think the second point for me, so the first point was about addressing the knowledge gap. The second point is about the health workforce and the critical role of mainstreaming developing that momentum for change. And then I think the third part for me is that the rigorous monitoring, and Iris mentioned this earlier, it's really agreeing on the right indicators. There's a lot of discussion around that ongoing, but the right indicators to show that these interventions are having their impact, so evaluating and disseminating that. It's all about reducing the barriers to change at policy level, because I think we hear donors saying, well, we can't fund facility level work because there's no models, there's nothing proven. It's very difficult to prove that this has an impact on resilience, but we've got to try, because I think the more we can dismantle each of those individual obstacles that are put up, then the harder it is for decision makers not to act.
Thank you so much, Doc. Now, Rastri, I will turn to Iris. And Iris, just address the issue around the connection between animal health, human health, environment, and how we can use all that to address climate change issues. Over to you.
Definitely. I would start by saying that I prefer to use the framework, planetary health framework. I think One Health and planetary health are definitely different terms, but they have, for me, the eventual similar end goal. And I think it's about understanding that all of what we're talking about is integrated in a much bigger system. So currently, we are facing a triple planetary crisis. We've addressed, I think, two of them quite extensively in this panel, which is climate change and pollution. The third one, biodiversity, we have not talked about today, but is definitely also a major crisis that interacts with the other ones that needs to be faced. I see this framework of thinking very much in understanding the issues that we face, so understanding these crises that we're facing at the moment. I also see it as a very important framework of thinking around solutions, because I also feel that this is a framework that underlines the importance of also thinking more broadly on how you implement solutions and who should be part of these solutions. So within planetary health, a very important part is, for example, indigenous knowledge and how that plays into solutions in a meaningful manner. So I think that both within challenges and within solutions, I would say that it, for me, is a very, very important way of thinking. So thank you for that question. And if I might add a little bit on accountability to commitments, which is what Francesca also asked about, is that I would say definitely, I very much agree with Kieran on the importance of indicators. I think academia as an independent evaluator of how things are going plays a very important role in that, in being able to independently and scientifically assess, I also think that commitments that have been publicly made by governments are in and of itself advocacy tools that can be used by many stakeholders from civil society to keep their governments accountable. So bringing those back to the national level or even local level, I saw these commitments have been made. How are they actually being implemented? And following up on those commitments that have been made sometimes at a very global level, but using those tools that are those commitments to then follow up nationally, locally, on making sure that the action is actually happening.
Thank you. Thank you so much, Iris. So, colleagues, I have to start bringing this down. And I know I may not do justice in terms of summarizing the nice points which have been spoken. But then I was writing, and there are key things which came out here clearly, the takeaways. The first thing which came out clearly is that although we are in a crisis, we have opportunities enshrined therein. But the question is, how do we take this crisis and turn it to an opportunity to transform the entire healthcare system? The second thing, which has come out very clearly, is that we need to put people at the center. And how to put people at the center is, first of all, to engage them, ensure that they understand and practice the policies and the guidelines that are out there. And I've also heard very clearly that we need to use tools like indigenous knowledge, citizen science, to harness the knowledge which they have, all that brought together, to start moving policies into practice and the way it's supposed to be. Then the other thing which I've captured very clearly is that we need to balance the actions around mitigation and adaptation. And those two are not opposing philosophies. So it's asking ourselves the question about where do we need to invest in adaptation most, where do we need to invest in mitigation most, and get that very right. Then the other thing which I had is that now we need to hold ourselves accountable as citizens of this world. We need to hold governments accountable. We need to ensure that when we go to the forums like COPs and those other policy-making forums, that whatever happens there, the decisions which are made there are actually implemented moving forward. So accountability to the commitments. Then lastly, it's the question about fast tracking. We don't have time. We need to move with speed. And we need to look at all the issues that are affecting us from a holistic lens. That's why One Health philosophy came out very strongly. Planetary health philosophy came out very strongly. So avoiding this kind of silo-based kind of programming. Now, because of time, I want to end it here, but I'll end it by requesting you to give a very round applause to my panelists who have actually tuned up for 1.5 hours. Thank you so much. Thank you, thank you, thank you.
Thank you so much, Dr. Muchangi, for a wonderful moderation. Can I take a photo? Yes.
Yeah. Just come here.
With your phone? Do we have a camera here? All right, well, while they take their picture, thank you so much, Dr. Muchangi, again, for this wonderful moderation. I see that there were many people very engaged with the Q&A. Now, it's time for the answer of the first question. I am very pleased to say that 96% of the people got it right. The answer to the question, which type of activities are essential for the long-term risk reduction in healthcare systems facing climate change, is both adaptation and mitigation. So good job. Now, before we jump to the next session, we will be allowing you some 30 minutes to take a coffee break, to chat, to relax, stretch your legs. And while you do so, do not miss the presentation sessions outside with the posters. We have a big screen, digital screen outside where you can, if you scroll with your fingers, you will see around 200 posters, and we will have posters each day with the theme of the day. So of course, today is about what relates to the nexus between the environment and our health. So tomorrow will be about migration, and then the third day will be about malaria. And aside from those posters, we will have the experts and the creators of those posters in there, and they can explain to you a little bit more about what is going on. So for now, take a break. Again, stretch your legs, relax, and I will see you at 4 p.m.